In this morning's Health Watch, ask it early. We've been collecting your health-related questions for our medical correspondent, Dr. Jennifer Ashen, who is here this morning with some answers for you. I love it when we do these segments.
I love them too.
Exactly what our viewers are asking for, so you've got the answers. The first one came to us from Facebook from Max, who writes, "My 19-year-old athletic son has high blood pressure. What will be the long-term effects of this disease, especially in a 19-year-old?"
Right, such a big problem. Most people think of hypertension or high blood pressure as only a problem that affects the elderly. Not true, and with increasing obesity, overweight issues, we're seeing it in children and teens. Now, when you see it in an athletic teen, you have to ask, are they using any steroid supplements or bulking muscle growth supplements that could potentially increase your blood pressure? You also want to find out why the blood pressure is elevated, make sure they have a full evaluation, and obviously don't check their blood pressure when they're doing sports. It really needs to be checked at rest. In terms of long-term consequences, it can affect almost every organ in the body: eyes, heart, kidney, blood vessels, and really controlling it with diet, lifestyle factors, and medication if necessary is the key.
This next one comes to us from Barbara in New York, and she also asked it on camera, I believe.
My question is, what are some of the symptoms of Lyme disease? How would you know if you had it?
Right, so Lyme disease is caused by the deer tick. It's a bacterial infection, and sometimes people, after they're bitten, can get a bullseye rash, a pale red rash with a central clearing. But about 25% of people who are exposed to Lyme disease never get this characteristic bullseye rash. But you can have symptoms ranging from fatigue to joint pain to headache, very, very vague symptoms. If you're in an area where you could have been exposed, ask your doctor to test you for it. It's a simple blood test, and the treatment is antibiotics, and you really want to treat it before it's been in your system too long.
Okay, this last question comes to us from Catherine via Twitter. It's a question about food allergies. She asks, is there a difference between allergies and intolerance? And I know that you actually know a lot about this on a personal level, Jen.
I sure do, and you know what? Both are increasingly common, Erica, and we don't really know why. But really, when you talk about food intolerance, that's really a digestive problem. So you might have a little sensitivity to certain foods. You might notice it appearing gradually. A real food allergy, that's an immune reaction. That's a histamine response. It usually can be immediate and life-threatening. I had an anaphylactic reaction 2 weeks ago where my face, you can see this picture, unrecognizable. My throat closed. I had trouble breathing. I went to the emergency room and needed steroids, Benadryl. If you think you have a true food allergy, an EpiPen is life-saving. You should have it in your house. You should have it at work, in your bag. Know how to use it. It could save your life.
Never go anywhere without it. And let people know if you're at a restaurant. Always
100%.
say, I have a severe allergy.
And mine developed at age 37, by the way. It doesn't always have to be from birth.
Right. Great answers, as always. Jen, thanks.
You bet.